Hi, my name is James Hopper at FSCG North Campus, and we're going to continue with our IV. We just finished the insertion, and now we're going to do medication through a mini bag. First off, what we're going to do is we're going to check our MD orders to make sure that we're giving the right medication to the right patient, the right time, the right dosage, and so on and so forth. So I'm going to come to my patient. I'm going to make sure 2 patient identifiers to make sure it's the proper patient. I'm going to assess the IV site to make sure there's no heat, no edema, no leakage from the IV site. And the next thing I'm going to do is I'm going to prepare my medication. I'm using lactated ringers today to aid with electrolyte balance. Today what we're going to use is our lactated ringers, so we're going to make sure that our medication is labeled. And the next thing that we're going to do is we're going to go ahead and spike our bag. So I have our IV tubing here that is labeled with 10 drops per minute. And we're going to go ahead and spike our bag. Okay, now our bag is spiked. I'm going to go ahead and fill the drip chamber. Next, I'm going to prime my line.
Wait, okay. With the blood too, and with anything, we have to click that on.
Okay, now the line is primed. I'm going to go ahead and gator clamp it and hang it up here, so when I'm ready to use it. Now I'm going to put my gloves on, come over to the patient, just remind him of what is going on, what the reason for the lactated ringers is, and continue from there. I'm going to go ahead and take my alcohol wipe and clean my port that is from the IV that we've already started. And I'm going to take my 10 milliliter syringe of normal saline and attach that. And the first thing we're going to do is we're going to start our ASHASH procedure. We're going to aspirate to make sure that we have blood return to make sure that we're still in a vein and we still have a good access site. Next, what we're going to do is we're going to flush using a push-stop method of 3 milliliters. After that, we're going to disconnect. We're going to take another alcohol swipe. We're going to take the line from our medication bag. We're going to clean our port. And go ahead and connect. Now with the calculations that I did earlier, we're going to do 100 milliliters an hour with the drops that are in the line of 10 drops. We're going to go ahead and do 17 drops per minute. So I'm going to go ahead and take my line and set up the calculation for that. That's 17 drops per minute. Okay, now that that is set up, we're going to let that sit, and we will tell the patient that we will be back with them once the medication is ended, or anything needed to call us for anything, we could come back and assess the site for any further information. So we have leave, and time has gone by. We have noticed that the 100 milliliter bag is now empty, and the patient has accepted the full medication. We're going to go ahead and assess the site to make sure that there's no leakage, to make sure that the patient actually got the medication that we wanted them to. I would go ahead and clamp off my tubing and disconnect my line. And then I would gator clamp it and hang it up here, just in case the patient needed it for any later usage. And I would take my 10 milliliter syringe filled with normal saline and an alcohol wipe. Wipe the port, let the alcohol air dry, and then I would connect and flush using a push-stop method of 3 milliliters of normal saline. After that, if ordered, I would use heparin for the last part of the ASHASH procedure, just as an anticoagulant to make sure that there's no clotting at the end of the catheter. After that, I would dispose of all my trash, any sharps that I had or ever used, I would use in the sharp container. And then I would document in my MAR and my input and output the amount of medication that we gave and the amount of diluted solution that we used for our input and output. After that, I would document how the IV site was and how the patient accepted medication. And that is how you use a mini bag.